I have 2 holes in my breast. It looks like a donut with a bite taken off and a hole in the middle. And the other one has a nipple that's going to the left. I have to insert gauze into my holes every day so I don't get infected. And it sucks looking at it.
I know that you said it's been healing, but
You want to see it?
No. Heck no. I have not. No. You've been completely depressed for 8 months.
Yeah.
Telling me that you can't look at yourself in the mirror.
I can't.
Why do I want to look at that?
In December of 2021, I decided I'm going to get my implants out. They looked really good, but they were so heavy. And now I am never, ever going to be the same. I'm a monster. It's like I can't even function.
I know. Well, the girls have been worried about you too, because they said that there are days that you just don't even get out of bed.
I can't. Because of the depression, I haven't worked. And honestly, if it wasn't for my mother, I mean, my girls and I'd probably be homeless. My poor kids. My girls look at me and they're like, we just want our mommy back. It sucks so bad. It's broken me.
Yeah.
I mean, if I could think of one word, it's broken. Because there's no way that I can go anymore looking like this,
Yeah.
Mom.
You know I'm 100% behind you. You know I love you so much.
Yo.
What's up, my brother?
We just got a referral from a plastic surgeon. Check this thing out. This patient who needs our help. Yeah.
I haven't seen that before.
Yeah.
That is a new one.
Yeah, so this is a patient who has had multiple previous breast surgeries. I don't know if these 2 wound pockets communicate, but this is an active, ongoing problem that is right now.
Okay, so a few questions. Number 1, is there currently an infection going on?
Exactly.
2, even if you can fix that, you've lost about 1/3 of the tissue.
That's right. So.
What's her name?
Her name is Tanna.
Can you please send in Tanna?
Tanna.
Hi.
Hi.
How are you?
How are you?
Nice to meet you. How are you? Hi,
Nice to meet
Tanna.
you.
Hi, I'm
Hi,
Tammy,
Tanna. Terry
her
Dubrow.
mother.
Pleasure to
Nice
meet
to
you.
meet
Good to meet you.
Yes,
Yeah,
I
they
can see
sure
the
do look
resemblance.
alike.
Yes.
Thank you.
So, Tanna, it's not very common that we see someone in the throes of the complication. Take us back to the beginning.
Okay, the first breast surgery was 1998,
Okay. So, what size did you put in initially? Do you remember?
550. About 2003, I meet my first husband. We took him out.
All right.
But in 2012, I had my second breast augmentation. 550, they were beautiful. Then, bam, divorce.
Yep.
You know, after divorce, you get a little chunkier.
Yeah.
Well, they just kept getting bigger and bigger.
It's too much.
Way too much. It was very painful. I mean, my fingers were starting to go numb. I mean, they were heavy.
So now you're developing functional problems.
Yeah, she's a nurse, so she's trying to
I'm a
move
ICU.
patients
You're
around.
an ICU nurse.
ICU. In the past, 3 years, ICU COVID nurse.
Really?
Yes, sir.
During the whole pandemic?
I ran it.
Really,
I
really
have
dangerous.
chills just thinking about it.
You must have been
Doctor.
freaked out, huh? I mean, how did you get COVID? You got COVID, didn't you?
Twice.
Twice?
I got it from a patient that was intubated. And the only way for me to get to press on his chest was I had to straddle him.
Loaded. Wow.
So I'm literally over him and his ET tube, everything's going in my face.
But what were you wearing on your face, though?
I was in a whole, I mean.
And you still got it?
Yeah, I was in
Her
my
own
own ICU.
You're
You were?
kidding me.
I've met a good amount of people that have been frontline workers that have taken care of patients with COVID, but Tanna, she tops it. That's almost like being in a war zone.
Okay, so 8 months ago or so, you had those 550s taken out.
Yeah. I had him done on December 22nd. 7 hours after surgery, I'm on the phone with him. Something's not right. I go, I am bleeding through my dressings. He's like, leave it alone.
And he didn't want to see you right away.
No, it started turning purple. He's like, trust the process.
He knew you were a nurse. He knew that you could identify
And I'm identifying.
problems and that there was a lot of bruising, which is probably indicative of reduced blood supply. When an ICU nurse tells you they're concerned about having a complication, you better listen because they are.
I did not see him until the 27th.
Wait. You had an explantation and lift and you weren't seen for a week post-op?
Right.
You can get an impairment in blood supply But the doctor has to immediately identify it and start treating it to minimize the damage.
Right.
You ignore it, it's just going to turn into black, dark, necrotic tissue and get infected.
So after the exam, the 27th, we bring her home, and she starts running fever. And
Yeah, the dead tissue is starting to get infected.
okay, we're going to the ER.
At that time, around my nipple, it's black. And then where he did the lift, black. Underneath was black. That's when I woke up from surgery and I looked down and there's just this big hole. And I'm looking into my breast that will never, ever be the same, ever again.
I can't imagine what that would be like to have to.
You haven't even seen it.
I won't look
You haven't seen it?
because I don't want her to see a reaction, and I would react.
Are you working?
No, mainly because of depression. I'm literally living off my savings.
And dealing
it's-
with this.
And dealing with this.
Okay. So if this maybe were fixed, you felt better, is that something you want to do, go back to work?
Oh, yeah.
It's her calling.
Yeah.
All right, well, we can relate. You're a hero,
Thank you.
and we appreciate
Will
you.
you be my hero?
I'm going to try. You ready for this?
I don't know if I'm ready for this, but
Sorry, Mom. All right.
Let's see what's going on here.
Oh, you ready?
Yeah.
And I'm still just doing wet to dry.
oh my God.
This is what I have to look at every day.
Oh, that's hard to deal with. I can imagine why you were depressed. I now know why she cries when she looks in the mirror. It is really disturbing. It broke my heart.
So let's see how deep it is right now. So this goes, tell me if I'm hurting you and I'll stop, okay? I have to figure out the extent and depth of Tanna's holes. Hopefully, if they only go a short distance, I can just remove them. But if they go all the way to the depths of the breast tissue, that could be lined with bacteria and could ultimately lead to a significant infection. Okay, that one's good. That one's minimal. What about this one? This one's done too. These are done. This breast is ready to do something, theoretically. The question is what to do. So if you think about it in terms of symmetry, which one sets the bar? This one, because this one is, we're not gonna make this any bigger. We're not gonna put an implant in. If we did, it would be a disaster. So if we can get this well-shaped, it'll be a small C.
I'll be happy.
The question is, can we do that safely without compromising blood flow? Because we know we have a reduction in blood flow. And then can we match this one to that one? In other words, can we reduce this without killing it? At first blush, it may seem like the right breast is much more complicated than the left breast, but actually, the holes in the right breast aren't very deep, so I can excise those easily. The left breast reduction is much more complicated because I've got to reduce large chunks of breast tissue with severely reduced blood supply from the previous scarring.
Can we do it tomorrow?
Okay.
Yes,
All right.
please.
It's been a long time that we've had some hope.
Cautiously optimistic. It's like the first time he was intimate with his wife. She took a look at him and she said, "Well, I'm cautiously optimistic that it's not as bad as I'm thinking it's gonna look."
Hey, here we go. Okay, come on. Let 'em know it's about to be on, yeah. Hey.
How are you feeling?
It's gonna be very hard for me to walk those stairs.
You're gonna be in the best hands in the world.
The last time I had to do this, I left and this happened. You know, I know it's not gonna happen again, but it's just scary.
Tanna, a true hero.
Yeah?
ICU COVID nurse.
Oh, wow.
I want to get you back doing what you do. As you can see, we have got a significant asymmetry. So the whole point is this one sets the bar.
Yeah.
This breast.
Yeah.
If this were an implant, this would be about $450, would it not?
Yes.
I think so.
Yes.
Do we have a $450? Could you grab one? big part of estimating.
That's 445.
All right. Feel that. Come here. Put your hands around that. Cup this.
Yeah, okay, yeah.
All right. Do you have a bigger one? All right. You have a 650?
Yeah.
So,
Yeah, that's, yeah, yes. I don't think it would be more than that.
yeah, I think so. Maybe this is about 200 reduction. My goal is to start measuring the various geometric dimensions of this breast and then apply that to this site. So it's like a geometry test, okay?
I hope you did quite well in geometry. Just throwing it out there.
For Tanna's surgery, I will begin by opening up her right breast and releasing the scarred down tissue. Next, I'll perform an anchor lift through her old incisions to remove the 2 wound pockets, rearrange the tissue to give her shape, and then stitch together skin to resemble a nipple. Then, I'll remove tissue from the left breast until it matches the right breast in both size and shape. After Tanna heals, we will give her a 3D areolar tattoo. Okay, since the right side sets the bar, let's start on the right first. Start by opening up the center portion. The key with this breast is to release the scar tissue as much as possible to try to be able to fold things up and give it a good shape, but not further reduce the blood supply so that the breast tissue dies. All right, let's see what kind of shape we can get. That's gonna be a really full breast if we can keep this alive. What do we think of this?
Kind of like it.
It's kind of a nipple.
Totally.
And then we'll tattoo around here.
Yep.
All right, now that we have the right breast made, let's see what we can do with the left breast to see if we can match it. Here comes the tricky part. All right, here we go. I've estimated that I need to remove about 200 cc's of tissue from Tanna's left breast to make it look like the right. The problem is, the more tissue that I remove, you may rob the blood supply and oxygen supply to the lower part of the breast, and the whole breast may die or fall apart post-operatively. I need about 200 grams of tissue. Here.
Just to add this.
52?
52?
Yeah.
That's
Yeah.
it.
Okay.
$145.
The more I take, the less blood supply I'm leaving, the greater the risk of injuring this breast. Man, this is a hard case. Can I have a handheld liposuction cannula?
Yeah.
So far, I've removed 145 cc's of tissue from Tanna's left breast. Unfortunately, I have about 55 cc's more to increase the symmetry with the right breast. I'm concerned that if I reduce any more by excision, I'll overwhelm the blood supply. So I'm gonna use liposuction to do the final further icing on the cake reduction, which allows you to remove more breast tissue. The nipple's alive, we've achieved symmetry, we've got good shape in both. I made her a little nipple. Little cute nipple. Let's get this girl back in the ICU, but not as a patient,
Right.
as a nurse.
Big difference.
All right, let's close. Awesome.
How you feeling?
A lot better than I did yesterday, that's for sure.
Really?
Yeah.
The right breast came together in kind of a nice, full way, much bigger than I thought it was gonna be. There was a little bit of extra tissue that I kind of brought together. Maybe I made a little nipple, because then we could tattoo the areola. So let's take a look.
Oh my gosh. Oh my gosh.
Oh my goodness.
Ooh, that pink.
I just remember when I saw them
Pretty
for
cool,
the
right?
first time.
Pretty cool.
I just want to hug both of you. I'm just amazed.
Dr. Dubrow did not bring Tanna back. Dr. Dubrow brought Super Tanna back.
That's amazing.
Cool, right?
Oh my God, I want to hug you.
amazing.
Oh, I can finally cry tears of joy.
Right?
Oh my God. This is exactly what I wanted. They're perfect.
Let's just keep a close eye on everything. Anything changes, you let us know immediately. Don't call us, come in. We will see you, okay?
Okay.
I promise you. So far, so good. Well, hello.
Hi.
How are you? Good to see you
to see
again.
you.
Tanna, how are you? Good to see you. This, ladies and gentlemen, is Jason. We brought Jason here for a specific reason, to finish the journey.
It's been a long road, and I am ready to have my life back. I no longer see a monster, just two beautiful breasts.
Isn't it amazing? It actually
No, it does. It looks three-dimensional.
looks three-dimensional.
That's called art.
We're good to go.
Wow.
This tattoo looks identical to the one that's really there. My breasts are symmetrical. I now have 2 areolas, and I think they're just beautiful.
You've always got away with me, even though I try to run from your love.
Before my surgery with Dr. Dubrow, my right breast had 2 holes in it, looked like a donut, and it made me feel like a monster. And I was so depressed, I didn't even want to go to work. But now, thanks to Dr. Dubrow, the holes are gone, and I have 2 matching breasts. My depression is lifting, and now I can go back doing the job that I love the most, being a nurse.
You can look in the mirror.
I can look in the mirror, and I'm like, there's your beautiful self again.
Well, baby girl, I look forward to everything in the future for you.
I'm excited for a new work position. I'm excited to do new things with my kids. I'm excited to hopefully find some type of relationship. Can't wait to get fucked. No, I'm just kidding. Sorry. I'm back. I'm back on top.